Ladies and gentlemen of the press, good afternoon. I wanted to provide an update on where we are today in our ongoing battle against the health and economic challenges posed by COVID-19. As expected, we are in a surge. This is a community spread, and I want to announce that there are 6 new cases. This means that as of today, April 1st, 2020, there are now 21 COVID-19 positive cases identified. 18 of these are confined to New Providence and 3 on Grand Bahama. The 6 new cases are all on New Providence. One of the new cases has a link to Grand Bahama. There are 1,500 diagnostic kits in our country today, and aggressive contact tracing continues. Health officials are following cases day by day. Through GIS mapping, we have identified hotspots on New Providence, and we have undertaken GIS mapping on Grand Bahama to identify hotspots there. We will vigorously step up our investigative procedure. The hotspot that we have identified is confined to the eastern end of New Providence. It's in the east. I've already communicated this information to the Commissioner of Police, and he has stepped up and ensured that everyone, inclusive those in the east, adhere to the curfew and adhere to policies that the government has instituted. This situation is constantly changing and evolving. So we have to adapt and to act quickly, and we must act decisively. The information we give the public will also change and develop. We are working hard to give the public and the media the timeliest and most accurate information possible. I want to address this afternoon the death of an individual who was transported from Bimini to New Providence. First, I want to offer condolences to the family of the deceased, including the Minister of Financial Services, Trade and Industry and Immigration, Ellsworth Johnson, as that was the minister's sister. We know that this is a very painful time for the family. The Minister of Health and other health officials have spoken publicly on this matter. The COVID test on this particular individual has been positive. The family has been informed, and investigation and contact tracing has already commenced. We pray for the deceased and the individual's family members during this very difficult time. Let me speak to the difficult and challenging issues of community spread. Our best weapon in this battle remains physical distancing and Bahamians and residents staying at home. I want to thank all of those who are following the various regulations and guidelines put forth by the government. We are saving lives, and you are protecting your health and the health of others. The Royal Bahamas Police Force continues to enforce our regulations. Those who fail to follow the order and regulations are taking risk to their health and the health of others. They are distracting the police from other essential duties and they may be prosecuted for failing to abide by the regulations which are designed to save lives. I want to speak very directly to all Family Island residents today. The orders and the regulations we put in place apply also to the Family Islands. Those orders apply to the entire Bahamas. I am asking Family Island residents to stay at home, except for the exemption orders within our jurisdiction. Please, I repeat, please, do not go wandering from settlement to settlement. Do not visit friends or families. Do not allow or accept visitors from other parts of the Bahamas within your jurisdiction. Be careful for those who visit your shores on boats. They can introduce the virus into your territory. But be assured that the government will continue to monitor and ensure that our family islands are safe. And they will be cared for. Whatever basic, what essentials are necessary, they can be assured that the government would most certainly provide that for them. We have to prevent any possible spread of COVID-19 on every family island and every key. Except for emergency personnel, there is to be no domestic travel within the country by plane or by boat. Be they boat by Bahamians who may claim to be fishing. Entering your shores may be devastating. Those who not abide by this may place other islands and keys and Bahamians in danger. They also take risk, and they risk being prosecuted. I want to repeat again to the family islands, and I will just choose a few. Inagua, Meguana, Rum Key, Ragged Island, Acklins, and Crooked Island. Do not travel outside your jurisdictions. Do not allow family or friends from New Providence or any other island outside to enter your shores or be sheltered in your homes. Do not allow anyone boating to enter your shores. Please continue to keep our family islands safe. Our greatest tool in the fight against this virus is following the public health advice to be physically distant from one another. There is no vaccine available yet for this virus, and there is no cure. The life in our family islands is very communal. We live close together. We visit each other. We share common struggles and take care of each other. But during this crisis, family islanders must make changes. Only go out to purchase what is necessary. Only go out if you are an essential worker. Do not assume that it is not in your community because no one has been tested positive. Every Bahamian and resident in every family island must take the same aggressive distancing measures being taken in New Providence and throughout our archipelago. Our advice and the emergency order are for the entire Bahamas. Family Islanders, I speak to you. You are dear to me. I visit and spend much time within the Family Islands. As your Prime Minister, I need you to comply with these orders. Let us keep our Family Islands safe. I do not want outbreaks in our beautiful Family Islands. It is largely up to you to determine what happens in your community, and as much as possible, stay home. Do not be tempted to come to Nassau, and do not be tempted to visit a relative, be they mother, brother, sister. Do not be tempted to visit them to your shores. We are all at risk from COVID-19. No matter our age, what neighborhood we are in, or what island we are on. This is a deadly and dangerous virus, discriminates against no one, including the young. So I repeat, all Bahamians stay at home. It is essential. If we want to get through this, we must follow the orders and the regulations put forth by the government. And the number one is stay at home and stop wandering the streets unnecessarily. We are in daily contact with the Family Islands to assess the situations on the ground. Let me talk about our medical and healthcare professionals who are putting themselves at risk to save our lives and to help our sick to recover. Every medical professional available is being called in to help. On the front line of our citizen army fighting COVID-19 are doctors, nurses, medical technologists, hospital and clinic workers, and other personnel. Let me be very clear up to this point. So far, more than 50 healthcare workers have had to be taken out of the system because of exposure to the virus. If our healthcare workers continue to be compromised or removed out of the system, then that places great challenges to our health system. On behalf of all of us, I thank every healthcare worker throughout our country. I know firsthand what they are going through. I can speak from experience. I understand the stress and I understand the anxiety. But I want them to know that we will win this battle and that we are getting them every resource possible to win this fight. I am extremely proud and extremely grateful to my medical colleagues who are working around the clock and under tremendous pressure. I also have 2 children. I have 3 boys, and 2 are medical doctors and who are also on the front line. Let me say this to my colleagues and to the Bahamian people. I will do everything in my power to protect the health and lives of our healthcare professionals and workers. every healthcare professional fighting COVID-19 and protecting our general health are a part of the flesh and blood of our community. As Prime Minister, as a medical doctor, and as a father, it is my solemn duty to protect the flesh and blood and the well-being of our healthcare workers. They must be protected for their own sake and for ours. We are working to balance COVID-19 care with regular health care. Toward this end, I wish to announce an Amendment Order 5 of Statutory Instrument number 27 of 2020. Emergency Powers COVID-19 Regulations 2020 Emergency Powers COVID-19 number 2, Amendment number 4, Order 2020. In exercise of the powers conferred on me by the Emergency Powers COVID-19 Regulation 2020, I hereby make the following order. Subparagraph 1B of Order 5 of the Emergency Power COVID-19 number 2, Order 2020, is amended by the insertion immediately after the words medical facilities of the words provided that. And what is most important to you is what I'm about to say now. All private medical and dental practices shall eliminate all routine and non-emergency physical encounters with patients and shall, as best as possible, provide all routine and non-emergency services using virtual or remote means, excluding private renal dialysis facilities. And where physical interaction is a necessity, due to a medical emergency, there must be strict adherence to physical distancing and hygienic requirements. Pediatricians who are involved in the vaccination of our population, of our infants, and protecting our future generation is exempted from such orders. Vaccines must continue to be given so as to protect our future generation. Obstetricians who take care of our antenatal or pregnant mothers must be exempted because it is essential for them to continue to deliver excellent health care and to secure the safety of our unborn and soon-to-be born children. They must continue to provide the care to protect our future generation. However, they too must take all precaution to protect themselves. To add to our citizen army and to help free some of our healthcare professionals for other duties, we are asking for volunteers to help the country in this hour of need. A volunteer hotline is being set up to register individuals who are interested in contributing to this fight against COVID-19, and we will soon provide more details on this. I also want to provide an update on various medical facilities. The modular unit at the Princess Margaret Hospital will be able to accommodate 4 additional patients within a purpose-built, controlled environment. The facility has positive to negative airflow with 20 air exchanges per hour of fresh air, and the air is filtered throughout. Intake air and exhausted air is filtered and also treated with ultraviolet light irradiation as further protection to ensure viral and bacterial kill. Similarly, the South Beach Clinic is currently being modified in the same way to accommodate 10 patients in order to accommodate a surge. There are also protocols at various facilities for the intake of suspect cases. We face two crises. Today we are facing the medical crisis, but very soon we will be facing an economic crisis. One of the crises we face is the COVID-19 pandemic that has claimed tens of thousands of lives around the world, and that will claim even more. In the United States, some specialists predict that the United States will lose between 100 to 200,000 individuals. We have already lost one. In our population, that is one too many. We can curb this if each of us be responsible and play our part. The other crisis that I speak about is the economic crisis it had caused that will persist after the virus is beaten back. Joblessness is on the increase across the globe and here at home. The economic crisis is severe for the Bahamas. Our economy is based on tourism. The world has closed its borders. We have closed our borders. Countries have had to do this to prevent a spread of a virus that has the potential to kill many people. With no tourists coming to our shores now and in the foreseeable future, tough times are here and tough times are still ahead of us. This is one of the greatest challenges to the world economy in most of our lifetime. We do not know how long this will last, but we do know that we will overcome this virus. As we had to assume great authority through the Emergency Powers Act, my government will have to make major changes in our economy. Tourism, which has carried us so well so long, is in a state of suspension due to this virus. And when it comes back, that is tourism, the Bahamas must be ready to welcome the world to our shores. However, no one knows when it will return. As a people, we have to be ready. We have to be ready to shift how we operate. The world is changing. The world that we saw yesterday will no longer exist. And it's changing rapidly. We must ourselves change. We must change our attitudes. We must change our behavior. We must make this crisis a crisis of opportunity, economic opportunity, financial opportunity, environmental opportunity, and social opportunity. COVID-19 has demonstrated that it has no boundaries, no borders. It has no political boundary. It has no political borders. It has no color boundary. It has no economic boundary. It is showing and it is demonstrating to us that we are all equal. We are all one. We are all one people. And I hope that as we recover from this COVID-19 virus, that we would remember the lesson coming out of this disaster. And we remember that the virus treated us as one people, as one. And we must remain after this as one. We must remain as one people. We have to be ready for generational changes to the economic structure of our Commonwealth. On the crisis assistance front, the Minister of Finance has announced 2 rounds of relief measures to help those hurt by the virus. These measures amount to tens of millions of dollars in various types of assistance. I urge everyone in need to make use of these initiatives that include food assistance, unemployment benefits, loans, tax credits, and deferrals. We will also shortly be making an announcement about rental assistance. To find ways to stimulate our economy now, and in order to create a master plan to rebuild our economy and to promote our social development, I will convene a high-level group of economic and other experts to provide concrete ideas and plans to the government of the Bahamas. And this group will help us to help chart the way forward for our national, economic, and social recovery. I will make a further announcement on this in due course. Even as we fight this health battle, we must be prepared for the economic battle that awaits us. Let me make some additional announcements. We are working on supermarket schedules to reduce the number of people on lines and in stores. This will be released by the end of this week. And tonight, at 8 p.m., the Ministry of Health will host a virtual town hall meeting focusing on the impact of COVID-19 on mental health, senior citizens, and persons with disability. The public is invited to participate by sending in their questions via the Ministry of Health's Facebook page on WhatsApp questions to 828-1265 or call in at 502-7382. This will be the first in a series of virtual town halls that will allow members of the public to ask questions directly to our health officials. And let me just say to every Bahamian and to every resident, 7 months ago, Dorian was hitting Abaco and soon to be over Grand Bahama. Now, COVID-19 has struck, sending death and devastation around the world. Dorian confined itself especially to our islands. We will only overcome through unity and purpose and God's guidance and grace. Let us pray for both. My life as a doctor and as a surgeon taught me about the need to maintain a strong head. It taught me the need to maintain a strong spirit. And it taught me, most of all, the need to maintain strong hands during crisis. But I also need your prayers. I need your help. As part of our Citizens Army, I need your ideas for our future and your continued adherence to the emergency orders and regulations on every island in our country. I commend all of those individuals who are taking these warnings and these matters serious. We will only win this battle if we work together. May God bless each and every one of you. God bless each and every one of us. May God bless the Commonwealth of the Bahamas. I thank you very much. And the health team is available to answer all the questions you, the members of the press, may have. Thank you very much. Yes, Guardian.
Good evening. Prime Minister, can you say if the government has any sort of contractual agreement with any air ambulance companies or private pilots that creates an obligation for them to collect Family Island COVID-19 patients?
Yes, we do have contract.
Then what went wrong in Bimini?
Pardon?
What went wrong in Bimini? Why it took
Yeah, but I said that
full
the
day.
matter's being investigated.
Okay.
Okay? Rashad?
You mentioned that the investigative process is going to begin with respect to the eastern area hotspot. I noticed that Jamaica recently said that one of the things they're going to do, as far as expanding their testing protocol is concerned, is to test a sample of everyone who presents to a healthcare facility, regardless of symptoms. Are some of the residents in the eastern hotspot going to be selected as part of a sample that's tested for the virus? And can we get some specifics on what the investigative procedure is going to look like in that area?
I will allow the professionals to answer you.
Yeah, thank you. Thank you for your question. We're looking at not only the areas where the contacts are many, the hotspots are informed by the number of contacts per case, and we're plotting that. So when we look at the different options we have for surveys, be it rapid testing, be it temperature monitoring, these are some of the modalities, and quarantine, community quarantine. This is what we are reviewing now, and what are some of the best practices. We have plotted the cases, we've plotted the contacts, we've looked not only at the contacts, but we've looked at what the epicurve is showing us. So together, temperature monitoring, temperature surveillance, testing, rapid testing, which is not, is a survey tool, not a diagnostic tool. And we're looking at the contacts in the hotspots that are having symptoms.
So there's no plan at the moment to maybe random sample or anything like that?
There is no disclosed methodology that we are prepared to give you today.
Okay. Are you able to say when we could expect to hear about the investigation into the Bimini case?
It is ongoing as of now.
Hi, Matthew Moxie from Eyewitness News. As a result of the Bimini death, is the entire Bimini under quarantine and expected to be tested?
Chief Medical Officer.
Okay. Certainly, our contact tracing would have begun in Bimini. So the healthcare facility in Bimini, sorry, will, of course, need to be, sanitized. But we will be working with our healthcare providers on the ground to ensure that we do the necessary contact tracing, as well as ensure that the health of our personnel is also protected. But the entire Bimini community, to my knowledge, is not under quarantine.
Okay, perfect. And then in terms of vulnerable communities, as for example, the shanty towns, what has been done for those communities so far to prevent an increase in cases?
Well, certainly from our preventive measures, we would have ensured that our messaging was actually translated into Creole, and we would have been working along with a number of the faith-based organizations from the Creole community to ensure that we have the in-reach that we usually require in order to manage public health concerns that that sometimes come to the fore related to those communities and the wider community. So we're working along with those communities to diminish the likelihood of having any, surge of cases.
Right. And just lastly for me, is there any plans to maybe outfit a Defense Force vessel to act as a medical facility for Family Island, similar to the Mercy ship?
No, there are no plans. We feel the Family Islands are a very cooperative group. I have no doubt that the Family Islands are very aggressive and enforcing the regulations that they would have heard originating from New Providence. And medical facilities are there for them, and we've made provisions should any need to be transported to New Providence. We've ensured that they can be transported properly. Alti.
Good afternoon, everyone. Altaviz Mannings from ZNS. Prime Minister, I have two questions for you, one for the health care professionals. Today, the Associated Press released an article saying the U.S. Coast Guard has directed all cruise ships to remain at sea, where they may be sequestered indefinitely during the coronavirus pandemic, and prepared to send any severely ill passengers to the countries where the vessels are registered. For most of the South Florida's cruise ship, that means the Bahamas, where people are still recovering from last year's hurricanes. Were you aware of this, sir? And
Yes, I'm aware of that, and there's an ongoing discussion between ourselves and the United States government.
Also, sir, also making the rounds today, a lot of people are talking about the BPL disconnections and the long lines that were at BPL today, ensuring that those customers who believe they were disconnected should not be disconnected. Are you concerned about that? Are you concerned about
BPL
that?
has made a statement that there will be no disconnection. At times when we're experiencing crisis, when individuals need to ensure that they have proper health care, each and every one are just as important as the other. And if one falls, the nation falls. So it's essential for us to protect and ensure that all has all adequate facilities. I'll give you one more question,
Okay.
since I like you, Alti.
Well, I just wanted to know, sir, when the test for the Bimini, when the test was completed for Ms. Rule from Bimini, and how long did it take for the conclusion to come as a result?
Thank you. The test was completed in 30 hours, and we got the result this morning.
Thank you.
Jerome.
Good afternoon, Prime Minister. How are you?
Good afternoon. Very well.
Good, sir. Good. I have several questions, or one question in several parts. Can we speak to the 6 new cases? Just curious as to what their conditions may be. Have any of them been hospitalized? You also mentioned that 1,500 test kits are on island. The Minister of Health had indicated that some 10,000 were on order. Any idea on the location of those, and do we expect them soon?
Chief Medical Officer.
So the 6 new cases, we would have hospitalized. We have. No, okay, if I say that we have 8 in Doctors Hospital West, that would be more than the 6 new cases. But of the 6 new cases, we have hospitalized, I think it's 3. I'll let Dr. Forbes actually go into that side of it. but we would have actually been moving persons from our Princess Margaret Hospital care to Doctors Hospital West. So we would have had a number of persons transferred down to the Doctors Hospital West care, where we have, by the end of the day, there will be 8.
8 in total are
In total,
hospitalized at this
yes.
point. And what are their conditions? Are they
Oh, they are all doing well. They're stable.
Okay.
They're stable. We don't have any that we have any, excessive amount of concern. They are all stable.
okay? And to the test kits, there were 1,500 on island. Are we still on track to get the 10,000 that the minister spoke to?
Okay, so we have 1,500 on island, and as we talk about the test kits, I always try to make the slight differentiation in the difference in the kits. The 1,500 that we have been referring to relates to the real-time PCR test kits, and the additional, I believe it relates more to the rapid test kits. And certainly we have to ensure that the rapid test kits are validated in country prior to moving to that method of sampling or screening, because a rapid test kit will only be for screening. The real-time PCR is the gold standard. So what we are seeking to do currently is begin that validation process to ensure that once we get to a point of being able to utilize those kits, we would move in that direction.
Prime Minister, in your remarks, you would have said that some 50 healthcare workers have been exposed. That seems a bit high. What is the reason for that? Do they have the protective gear, or what seems to be the cause for some 50 people to be exposed?
You would know that you would have visited a doctor's office from time to time. A doctor would not know that that individual is positive, and he would do all of his or her procedures and examinations as required. And he may subsequently find out at a later date that the patient that he operated on or he was seeing was COVID positive, which means that now he must be quarantined and all.
An order relative to insurance company payments. I do understand that a lot of insurance companies have pushed back on that, saying that they weren't even consulted. Has there been any further discussion with them today since that order? And are there any plans at this point to amend those orders in any way?
My understanding that the insurance companies were very happy that they are able to proceed with their work.
They're happy, sir? Despite
That
the
was my
reports this morning?
understanding. That was my understanding.
Well, the reports we received said otherwise. Have you all spoken since? Has there been any
Obviously, I would
discussion?
have to follow that up.
Okay, all right, sir. Thank you.
Thank you very much. Guardian, thank you very much. I'll see you at the next one. Have a great day, ladies and gentlemen.
Thank you very much.